Tell me about what gets you up in the morning and what makes you feel as though you've done something good that day and how you've envisioned this going forward.
I think one of the most important aspects of my job is not only to be of service and be helpful to the patients, but the ability to be creative. And that's what keeps us from getting bored. I think it's a basic human tenet is to be creative. And that's what gets me up every morning, because I always think, what are we going to do today? What are we going to do different today that we couldn't accomplish yesterday? How are we going to solve that problem that has been evasive? The solution has been something that we can't get our hands around, and we put little pieces of experience together. We talk as a team. Someone always has an idea. We evaluate it, good, bad, or indifferent. And of course, we're always thankful to the patients that are courageous and are willing to try some of these new techniques. And we're also very thankful for the environment that we work in, because healthcare is a tough environment in many ways. There's real burnout that can occur. But if you get up every morning and say, I'm here, I'm reporting for duty, what can I do? And just do your best every day without expectations, but with the hope that you can make things better, that's what keeps me going.
I will say this about interventional cardiology and what we've done together, and that is the amazing thing is every day when you get up, you know that day is going to be different than any other day you've ever had before. And that's what keeps me going. I remember driving to work one morning, 10 years ago, 15 years ago, and it was sort of a dull, rainy day, and I felt a little bit, do I really want to go to work? And I said to myself, I have no idea what's going to happen today. And I know it's going to be different than anything that's happened before, so that every day is a new day of thinking about a new problem or thinking about an old problem and so forth. I agree with you. I think that's a very important part of what makes us keep going. There is one other very important thing, and that is patient care. The bottom line is that lying on the table is a person. For me, that person lying on the table that we're working with has to be the central part of what all this is about. And that sounds trite and sounds as though you've heard that 1,000 times before, but there's something about caring for somebody, making them better, seeing them get better, that really makes me feel that I've accomplished something. And at the end of the day, if the patient is able to say, thank you, you've helped me, that's about all you can ask for in medicine. I always tell fellows, if you do a little bit more good than you do bad during the course of your career, you're probably ahead of the game.
Yeah, the patient is the center of the story, for sure. They're the inspiration for why we were looking for different solutions. They cheer us on, obviously, when things are successful. They help us to regroup when they're not successful. No one came here by stork, right? Somebody is always a brother, a sister, a mother, a father, a child to somebody. And I certainly feel this very strong connection with the patient, their families, as if we're one big community. This connection is the most important. It's when I'm at my best, is when I'm connected with the patient. I always say to the students, to the fellows, the patients always have the answer. If ever you have a question, if you're not sure what to do, go talk to the patient.
Ask the patient. You're right.
They always know.
Yeah, they always know. Every once in a while, we did some pretty good stuff.
You're right. Every so often we get it right, and that's why we keep going.